Assalamu alaikum viewers. Welcome to the North American Muslim Foundation senior talk show funded by the New Horizons for Seniors grant. On our talk show for today, we have Naila Butt. She has been in the community she has been working in the community as a public health professional for the past 15 years and an activist. She's very much involved with community programs and she's very much involved as an ED in various organizations. So let's welcome Naila Butt today to our program. Welcome to the show, Dr. Naila.
Thank you, Sajda. Thank you for inviting me.
It's a pleasure always to be with you to talk about the community, to receive a lot of information from you, Naila. And today on this talk show, we are trying to collect information as to how we can provide better services for seniors and try to find the gaps within the services. So we would like to hear about you and your life and immigration to Canada. Would you share some light on it?
Yeah, so I immigrated to Canada about 13 years ago, and it was not because of any financial reasons, but basically, to provide a better future for our children. So we had a very established practice and everything in Pakistan. I was running the administration of a hospital and also running a not-for-profit organization. But we immigrated here, I have my two sons, and I didn't know anything about Canada except that it's a very cold country. Yeah. But I was very pleasantly surprised because we had a very nice warm welcome. We didn't know anyone over here. Yeah. But the support systems that were there, helping immigrants out, those were I found them very useful. And I had never worn Western clothes, although I had lived in England, but I never compromised my, the way I dress. But when I came here, the organization showed us how to dress, how to, talk in the community, how to sell yourself, which was very, very difficult for me because, in Pakistan, they tell you, no, you're a show-off if you talk about yourself. But over here, it's different. You have to say that, I did this and I did this and so it was...
You have to promote yourself. That's what I heard.
Yourself, So, it was very different. But alhamdulillah, by the grace of God, I was so lucky that I got my first job within 3 months as a project officer, and within, I think 4 months, I was the executive director of a not-for-profit social services network, which was, dealing with immigrant issues. Yeah. So, it was a wonderful journey because, through that, it helped me, assimilate in this society and also help me understand what problems immigrant communities have, in Canada. So, it's
and you have addressed a lot of those issues and you have worked a lot on those issues as well. We'll be talking more about those, and especially today's talk show is more on seniors and how we can provide them various programs and what are the gaps in services that we can find. Now, as dealing with the seniors, did you find any challenges that they must have come to you with in regards to the medical services here in Canada?
So yes, there are a number of challenges, and actually you can, most of my work that I did at SSN was basically with seniors as well, with women as well as seniors. So in terms of the challenges, of course, language is a big barrier for those who are, recent immigrants. Then, cultural barriers for, accessing the health system, how to navigate the health system, which is very, very difficult. The other thing is, transportation. That's another big issue because, if you come as a senior, it's very difficult. How do you don't have a driving license, you're dependent on your children. If you don't know the language, you go to the doctor and, he doesn't understand you. You can speak English, say hi, bye, and, whatever. But when it comes to explaining the kind of frustrations or what you're feeling, and mental health issues, you see, you have a lot of loneliness, isolation. So those were like real, key challenges. The other thing, in the Canadian health system, it is a very good health system, but only for emergency cases.
Yes.
But for chronic conditions, it is very challenging, and I'll be very specific in terms of, when I'm talking about seniors over here, it would be the South Asian context, right? Which would be India, Pakistan, Bangladesh, and all that. So you see, over there you also have a private health system. So, access to private health services, you can access them. Yes, you have to pay a lot of money, but you still can access. You have alternative systems where you can access healthcare. Unfortunately, you see, for chronic condition like diabetes, I like everybody after the age of 65, you're heading for that. So for those kinds of things, it's very difficult to get the to get the service. In an emergency, it's an excellence. I mean, you just go to the ER and boom boom, you'll get the angioplasty, you'll get anything. But if it's chronic, then it becomes very difficult.
And sometimes what happens is, even it might be a chronic condition and there might be some other issue that they would have. It's so difficult for seniors to go into the emerge and sit there because there's a triage system, right? Unless you're bleeding and unless there's some great issue, they're not going to attend to you. And that's another condition that the seniors always address, saying, I'm not going to go into the emerge and sit there for 8 hours and spoil my sleep. Because then that again gives me anxiety in the morning, then I'm unable to sleep. So there are more issues for me to go to the emerge, and I would prefer, rather than that, just staying back at home.
Absolutely.
So how can that gap be addressed?
So the thing is, during my work, with SSN, this is what I'm a great advocate for community health centers. I think you need to have a strong community health system,
advocacy.
And your GPs, your primary healthcare providers, they're the backbone of any health system. And I think that's how the Canadian health system was envisaged by Tommy Douglas, who actually talked about, who created this universal healthcare system. But you see, the plan was that you're going to first provide services for those who need it the most, which would be emergency services. But then the second part of the health system was that you are going to strengthen the primary healthcare system, strengthen the GP system, strengthen the referral systems, right? And that's not happened. So that's why, so I think the more we strengthen our primary healthcare system, the more we, focus on prevention of diseases, public health systems, they need to be strengthened. And, this is what was so evident during the COVID. That you need to have you need to have a primary healthcare system if you want to control diseases.
That would help people try to maintain a better health rather than just stay back at home and not take care of the chronic health and then get into the emergency. Because chronic health conditions, I think every other individual suffers from one chronic condition or the other, and that develops to the second condition and the third condition. And that's extremely important, that issue that you have raised, and that concern is extremely important. What other advice can you give to the GP? Because most of the time when we hear, one concern that the seniors have is, the general physician, doesn't show much interest. When we go, they just talk to us, everything okay, these are the medications that you're prescribed, and there's nothing that they can do for chronic conditions.
It's again, I'm talking more at the system level. There are quite a few challenges which the primary healthcare providers also face in terms of. And I'm not at all negating what you're saying. Yes, definitely. I myself have suffered. During COVID, I had a disc prolapse, right? And I kept on calling my GP, and she refused to see me because she said she was on phone and she could not, without examining, she did not know that I had a disc prolapse, right? So it kept on aggravating. I was doing the exercise and ultimately I couldn't move, So again, that was one of the failures of the system, where, if you don't spend time with your patient, you're not going to find out. But, the way the system, how the healthcare providers are paid, the more patients that they see, it's also, it's some kind of...
But they have a time limit for that, isn't it?
So, yes, there's a lot of need for improvement, and I think it also varies from GP to GP. There are some who are, who are very concerned about their patients. They do that. So, it varies, but I agree that there needs to be, more, more time spent on the patient. The other challenge, which, again, I'm speaking from a healthcare provider perspective, the referral system is very weak in terms of, the GPs will, give you a referral because, again, they're limited in what they can also provide to the patient, right? So, if, for example, they have to go to an endocrinologist or a cardiac, they give a cardiac consult for heart disease or anything like that. The problem is that the waiting times are enormous, So, like, you're waiting for 6 months to get an appointment, so it's ridiculous.
It is.
The thing is that we have a lot of opportunities, like, there are so many immigrant doctors, who are highly qualified, and they're not getting an opportunity. Look at this, like, even during COVID times, there are doctors who've given their exams, the Canadian, but they're still not getting even a placement, They're not, like, even observership they're not getting, so it's, not using the resources that
they're not using, and especially they do not have an idea that they're extremely talented. These doctors, these youngsters, they're extremely talented. Had they been given an opportunity, they would definitely prove themselves, but they're not getting an opportunity.
I mean, my husband, he was a urologist back home, right? He was a consultant and, like a transplant surgeon and all that. He literally had to go through all his exams and everything, and alhamdulillah, now he is practicing. But the thing is that it was because he had, he had worked
expertise,
in the UK as well, that
yeah.
he was able to enter the system. Otherwise, if you are like a graduate from India, Pakistan, Sri Lanka, Bangladesh, there's no way you're getting into this system, you know. So it's
and really, there is a need. There's a need in the community. Even I hear from the seniors as their knee replacement, hip replacement. They have to wait for a year or two, and they prefer going back home and getting their operations and the replacements done and then come back.
Absolutely, I think there is a need to revamp the system, and it can be a more efficient system. They have the resources, They
have.
So I think there's a need to strengthen and revamp the system, and better utilization of the existing resources that we have.
No, that's a very valid suggestion that you have given, because all across the globe, everybody talks about when there's a doctor, he wants to migrate to Canada, they say, please don't go. You don't want to go and become a cab driver there.
Yeah, exactly.
So there was a movie also made on that, how the doctors are immigrating to Canada and then becoming cab drivers. So definitely there's room for improvement. How would you like to address the issue of transportation with seniors?
Transportation, again, I think it is a challenge. The public health system, the transport system is, in Toronto, it's pretty good actually. I've just recently shifted to Mississauga, and I'm finding the challenges over here. So over there, like you have the subway and all that. But for other areas, it is a challenge. But I think with again, where they call and they get that.
There is a wheel trans service, but then not everybody is accepted into the wheel trans.
It is very difficult.
Unless you break your leg on your hand.
Exactly. So again, I think seniors getting together and carpool and stuff like that. But it is tough. I think it is tough. And now, but with Uber and all those, but again, the cost of that is also high. You see, with seniors, they have limited income, and it becomes it is very difficult, and especially in the snow and all that. It is, and I think again, I'm all for the public. You have to again strengthen the public transport system, because cars and all these, they're
especially with seniors living with chronic illnesses. The best way is to educate them with the programming, and once you want to educate them with the programming, the next step is they're always talking about transportation. They say, we are unable to get transportation. How do we reach to these programs? Carpooling, again, friends say it's a legal issue, when you want to take someone into the car.
That's what they say, exactly.
So we don't want to get into that.
the other thing is, again, community hubs are the other way, like you can have, for programming specifically, you have, but how many hubs can you have? But again, I think volunteerism, and then, you have people volunteering, the buddy system where, you can help each other out till the public health. And, again, when these people want our votes, we have to tell them, you have to strengthen. So it's a slow process.
Yeah, a seniors program. But you have to strengthen the program for seniors.
We have to do that, absolutely.
And what advice would you like to give to the seniors who, are totally isolated and related to mental health? So how would you address that issue?
So, again, before I immigrated to Canada, I was under the impression, I used to think, I'm going to go to Canada, I'm going to, find myself a nice seniors home, and I'm not going to be dependent on anyone. This is what I'm going to do, this is life.
Yeah.
But when I came here, and because like I said, I worked, with seniors a lot, so I used to go to different senior homes as well. And yes, it's okay, but, it's isolating, especially, I'll be very specific about South Asian seniors or Muslim seniors, right? I visited certain seniors' homes where, the food is not culturally appropriate, the language, they're like sitting over there, all alone. It was so, it was heartbreaking. I'm telling you, it was so heartbreaking. And then during COVID, when I saw all those seniors dying, because, and their children couldn't see them, and then I said, what we have, again,
our
from a very
system,
religious, not just the culture, I think
even the religious point of view.
We have from a very Islamic point of view, that, when you do ihsan on your elders, right? So when they become as children, like you were when you were
a child, they took care of you when you were a child. They took care of you.
So you have to, so frankly speaking, to be very honest, I think the best way to address this issue, this isolation, is we have to build the community towards this. Like they say, to raise a child, it needs a community to raise it. So for a senior, that's exactly what it takes.
True.
So, it could be your father, my father, like we have to help each other out. And, I still travel very frequently to Pakistan because my mother is alive and, she's there, and my mother-in-law is there. So we go, but and I've tried to bring them over here, but they say, we are here, we are okay for a month, but we don't want to live here because they have their own,
they have their life, and there's so many people coming there.
When you grow old, you don't need all this, you
don't need the luxury.
You don't need dresses, you don't need makeup, you don't need any of that. All you want is someone to talk to, right? And the thing is that over, over there you have like somebody's coming,
neighbors,
somebody's
your
asking
friends,
you, what's...
they respect elders a lot. They respect elders a lot.
We have to have that, help each other out, build that, where children can go. Like, we had a program, we had launched a program over there as well, again, getting the seniors together at Hub, but also getting school children involved, give them volunteer hours, go and talk to them, which is sad, I think it should be, because the seniors have given so much to the community and the children, so it's their time now. So we have to, all they're asking from us is time, So I think that's very important. But having said that, this is for those seniors who are, able. But for those seniors who become dependent, you need to have proper seniors homes and,
culturally relevant.
And I'm a big proponent of also, having a South Asian and Muslim seniors home. I think there's a great need. In fact, I was just outside, I was talking to Farooq Saab, and I said, you've got the place here, you need to really advocate. We need to advocate as a community to do that, and and support, those people who are
initiating towards it.
Seniors, who are dependent on them, and then we have to advocate to the policy makers to give some incentives to those families who are giving their time, for example, just like they give to fathers and mothers, and they get paternity, you need to get parental,
Parental leave, yes, for the
take
senior.
care of your dad. You
Yeah.
need to get some incentives, subsidies for those,
children
people
who are taking care
children
of
who are
the
taking care
parents.
of their parents, and
Yeah.
this is the reality,
Yeah.
So I think there's a lot that needs to be done, and something which should, make us rise in the morning
Rise,
and
yes.
start doing something.
Think
There's so
about
much
it
of
and
work
put
to
up
be
a
done.
plan.
Yeah,
Yes.
yeah, so-
No, it's wonderful. It's wonderful, Dr. Naila, for having you on the show. And, your valuable feedback is so important, and there's always room for improvement. So, as we have discussed in this show, definitely the seniors need a lot of your time, and for the ones who are trying to age in the house, nothing better than that, because the children are there taking care of them, but again they need to be compensated for their time. So once again, thank you so much for watching these episodes. Today was our last episode with Dr. Naila Bhatt, and we have received a lot of information. So once again, please try to contact your nearest program so that you can enroll your parents in there. And seniors, if you are listening to this, please don't sit at home. Join a group. New Horizons for Seniors provides so much of funding across the city, and there are many programs around in the city where you can go and spend your time effectively educating yourself to age gracefully. So once again, thank you so much for watching our show, and thank you, Dr. Naila Bhatt, for being on this show with us
My
today.
pleasure.
Yeah.
Thank you for inviting me.
So this was our last episode for today. Your host, Sajida Khan, and this program was funded by the New Horizons for Seniors on behalf of the North American Muslim Foundation. Thank you so much.